Now, finding a doctor is a little less challenging. United Health Group is investing in tools that make it easier for patients to navigate healthcare and pay less. These transparency tools help patients find providers, and this is the big thing: compare costs up front. The big picture? More transparent pricing benefits everyone. And these tools from United Health Group can help patients save hundreds of dollars annually. Learn more at unitedhealthgroup.com/commitment.
Life's busy. Don't let banking slow you down. Whether you're paying bills, setting savings goals, or just splitting the check, Atlantic Union Bank makes managing your money easier. With helpful people and user-friendly tools, we make sure banking with us fits you. Call, visit us online, or drop into an Atlantic Union Bank branch today. Atlantic Union Bank. Any way you bank.
You're listening to In Good Health, the trusted news source for medicine, science, and technology. I'm Elizabeth Westfield.
I'm Mayan Vasta Betancourt.
And I'm Greg Johnson. This week, can hypnosis heal your gut issues?
There's no bell going off and clucking like a chicken. It's very different from maybe the stage hypnotherapy that you've seen at like your senior party or on a cruise ship.
But first, facing the beyond with a death doula.
I think we'll all get to the end with many regrets, unfortunately, but there's still time right now. And so helping people realize that as long as there's breath, there's still room for joy, and saying, how can we find that? How can you get to that?
All that and more this week on In Good Health.
United Health Group is simplifying healthcare by investing in tools to help patients know more and pay less. These tools help patients find providers and compare costs and save hundreds of dollars annually. Learn more at unitedhealthgroup.com/commitment.
Bringing your business dreams to life takes heart and about 1,000 decisions a day. That's why Atlantic Union Bank's knowledgeable bankers are here for you with the right guidance and customized solutions to help you reach your business goals. So whether you're planning your next move, upgrading your space, or scaling to meet demand, we make sure your business is ready for what's ahead because we're big enough to support you, yet small enough to know you. Atlantic Union Bank. Any way you bank.
It's not easy to talk about death and dying, especially with a loved one who isn't ready to go, despite the fact that their days are limited. But refusing to face reality takes a toll on everyone. Since there's no instruction book on how to handle this transition, some people have begun to turn to death doulas. Just like how birth doulas help mothers navigate labor and delivery, a death doula provides that guidance for the dying.
A death doula is someone who is there to help the dying person or the family at the end of life. It's just someone who can be there at the end of life and hold that space. But we all do so many different things that, for me, I'm a writer and a death doula. And so a large part of what I do is help people tell their story in the end. That's my goal. And also to make sure they're not alone. So I like to sort of combine those two things.
That's Darnell Lamont Walker, death doula and author of Never Can Say Goodbye, The Life of a Death Doula and the Art of a Peaceful End. Walker began training for this work as a 13-year-old boy. He volunteered at a local hospice and would also help his grandmother attend to loved ones who were dying.
I had a cousin that same year who came home to die, and my grandmother took care of him, and I was always there with her. And so watching that and just always being there since I was even much younger than that, being there with my grandmother as she made her rounds to her sick friends and friends who were in the hospitals and friends who were, very close to death. And then as time went on, it became, I was able to be there for my grandmother. I was able to be there for my grandfather. And a lot of this was before I'd even heard the term death doula. This is just watching her, this is what we did for family. This is what we did for our friends. This is how we honored people and remembered people.
Rather than being afraid of death, Walker was curious and hungry for more information. Even as a young boy, he wanted to know more about what it meant to die.
I just kept asking questions. Well, what do you want to happen when you die? Or, when I die, this is what I want. And so I was never afraid of it. It'd be terribly inconvenient right now, but the fear isn't there.
But a lack of fear doesn't provide protection. Sooner or later, all humans must face our own mortality. For Walker, that day came at age 22, when he was diagnosed with a blood clotting disorder that almost took his life. Though he didn't fear the possibility of death, it did make him ponder how he wanted to live the rest of his life.
I have to wake up every day and choose to live in a way that some people might not. And I've seen how that's helped shape my life. There are things that have become so unimportant. It's like if I can move toward the joy and not, maybe this job that I don't like isn't that important. Maybe I should take this trip. Maybe I need to tell these people that how I feel. I do love you. And you get to the things we want to. It's that same question we ask, over and over. It's like, if you had a year to live, what would you do?
Which is the energy Walker brings to the people he serves. As a death doula, he helps them face their mortality and, whenever possible, die with fewer regrets.
I think we'll all get to the end with many regrets, unfortunately. But moving forward, they don't have to be so bad. Yeah, I wish I'd eaten dessert first in those last 20 meals. That's fine. But if it's, I should have left that job a long time ago and I've been miserable for 20 years. It's like, okay, well, let's talk about that. There's still time right now. And so helping people realize that as long as there's breath for many of us, unless we are in that active dying stage, as long as there's breath, there's still room for joy, and saying, how can we find that? How can you get to that?
But facing regrets can only come after you face the reality that you're dying. For many people, this can be a huge hurdle, especially for those losing the fight against a disease. For some, saying the D word feels like giving up, so they ignore the conversation altogether. It's a discussion Barbara Hansen would have liked to have had with her youngest daughter, Carol, who died of pancreatic cancer at age 29.
They were trying anything on her because she was desperate to stay alive. And I didn't say anything, but I thought it was too much. I wouldn't have allowed them to do some of the things to me that she did. I think it was her fear, or if not fear, the great desire of a young person to live.
Hansen is a 96-year-old resident of Georgetown, Texas, and mother of 8. Carol's strong will to live meant any conversation that mentioned death would be shot down.
We were all young and had never experienced anyone close to us leaving. I think it was the first time any of the kids had experienced a death. And if she had been open to talking about it, it would have been freeing and helpful to all of us. She didn't want any of that. She thought till the last minute. And I tried to talk to her, but I knew it would either frighten her or anger her. I didn't say too much. To me, it was fear and her desire to live. She was young. She had her whole future ahead of her. She was recently married. I knew she did not want to go there.
Hansen's son, David, remembers what it was like back then, how Carol's health status was only to be whispered about behind closed doors. He says it began to shape how people approached her.
I remember being with her, and I don't know if all my family's going to listen to this, but my 2 brothers were noticeably not available. They didn't want to come. And they were the ones who were there then when she did die. But I was like, wow, they didn't seem to want to come to visit her at the time. Now, maybe that had nothing to do with not talking about it, but it felt like there was a need to stay away. Not quite sure how to handle dying.
Had a death doula been available to the family, they may have avoided the pain and regret of words not spoken.
If we don't do this, there's so much that will be lost, and there will be so much more regret. And if we do this, we can have these conversations so fast and so quick and get them over with that we can get back to whatever good and whatever joy can come from these moments. Because now you're just walking around avoiding it, and it hurts and it's painful, and everyone's wondering what everyone else is thinking, when a lot of times if you could just sit down and talk, it'll just pour out, and you've built this community, and you have these people who can then hold you up and hold each other up.
And though death is an uncomfortable topic for many of us, Walker has also worked with people who are choosing to face it head on. 10 states have legalized medical aid in dying for patients with a terminal illness. Legislation to legalize medically assisted dying is expected to take effect in the state of New York later this year, and 13 other states are considering similar legislation. Compassion and Choices is the name of a nonprofit association of healthcare professionals that recognize medical aid in dying. Another group is Death with Dignity National Center. These organizations help patients and their loved ones make critical decisions about how the patient wants to end their life. Once Walker has established rapport with his dying clients, he can approach what he calls legacy work. This is where he helps the family or loved one write an obituary or eulogy.
I've been reading obituaries since I could probably read. I loved reading obituaries in the newspaper. And I was always happy to see those, page and a half, 2-page obituaries with the amazing photo. But then it always made me so sad to see the 2-3 sentence obituaries. And I thought there's more to these people's lives than, they were born and they leave 4 people behind and they die.
Walker interviews the dying when he's able to, getting them to open up about their childhoods and the pivotal events in their lives.
It's amazing, these stories that we hold in and or that we forgot. Once we start talking and they're like, oh, and then this, and then, I love to just dig deeper and dig deeper and dig deeper. And so they sit and they start writing and they realize, oh, I do have a story I want to leave behind. It's more than just, I had kids and I worked as an engineer and I had a dog and I died. It was, I was a person. And it's legacy work.
Walker's book, Never Can Say Goodbye, The Life of a Death Doula and the Art of a Peaceful End, is available now online and wherever books are sold. You can find more information about Darnell Lamont Walker and all of our guests on our website, ingoodhealthpodcast.org. For more behind the scenes, follow In Good Health on Facebook, Instagram, and X. Our writer-producer this week is Polly Hansen. Our lead producer is Kristen Farah. Our executive producer is Amira Zavari. I'm Elizabeth Westfield.
Coming up, everything you need to know about gut-directed hypnotherapy when In Good Health returns.
United Health Group is bringing in-home treatment directly to patients, closing care gaps, identifying risks earlier, and improving patient outcomes. In 2025, patients received over 19 million home visits. Learn more at unitedhealthgroup.com/commitment.
Bringing your business dreams to life takes heart and about 1,000 decisions a day. That's why Atlantic Union Bank's knowledgeable bankers are here for you with the right guidance and customized solutions to help you reach your business goals. So whether you're planning your next move, upgrading your space, or scaling to meet demand, we make sure your business is ready for what's ahead because we're big enough to support you, yet small enough to know you. Atlantic Union Bank. Any way you bank.
If you've ever dealt with any gut issues, you probably know how hard it is to get a concrete diagnosis. Gastrointestinal diseases are difficult to treat because so many of them share the same symptoms, meaning doctors are often forced to slowly narrow down the options. Some conditions have a clear physical trigger, while others, such as irritable bowel syndrome, can be caused by anything from an infection to poor mental health. Dr. Megan Reel is an associate professor of medicine and clinical director of the GI Behavioral Health Program at the University of Michigan. She says IBS is considered a disorder of gut-brain interaction.
So a patient with IBS has kind of like a ramped up version of the brain-gut axis. So sensations that are happening in the gut get sent up and signaled to the brain. The brain is focusing very heavily on what's going on during the digestive process. And this leads to impact on motility, so how fast or how slow food in the digestive process is happening.
And it can amplify pain signals, making it difficult for your mind to regulate the discomfort.
When we have those symptoms that are happening for people that have IBS, for example, the brain is very heavily connected to all of this. And really, our stomach is also thought to be our second brain based on this communication pathway. And it's a bi-directional communication pathway where, the gut is sending signals up to the brain and the brain is interpreting those signals and deciding what to do with them. And unfortunately, sometimes it turns them up and we feel those symptoms more intensely.
Since this gut-brain interaction is such a critical component to healthy bowel functioning, Reel says medication isn't the only option patients have. Psychological interventions can be extremely successful in treating IBS. One that Reel specializes in is called gut-directed hypnotherapy. Her new book, called Mind Your Gut, breaks down IBS management, including her use of hypnosis.
In our clinical work, there's no bell going off and clucking like a chicken. It's very different from maybe the stage hypnotherapy that you've seen at like your senior party or on a cruise ship. Medical hypnotherapy, going back to that concept of disorders of gut-brain interaction, actually utilizes very targeted protocols and suggestions to restore the way the brain and gut communicate.
Research for gut-directed hypnotherapy began in 1984. Since then, various studies and randomized control trials have proven that it's an effective treatment for disorders of gut-brain interaction.
We utilize a combination of focused thinking, guided body relaxation, and very specific suggestions about the functioning of your brain and your gut. And when we do that in this kind of protocolized way, we see patients have improvement in their GI symptoms, in their coping strategies, and their skill set,
as well as learning ways to fully relax their body. While it's probably a skill all of us should have, being able to relax is especially important for people with GI issues, since stress can worsen some conditions. Another big part of the hypnotherapy is bypassing the conscious part of the brain that does so much of the overthinking to speak with the subconscious. Reel says the process helps remind it that there's no need to hyper-focus on anything because it already knows how to go through the digestive process.
We've become way too hyper-focused on this situation of, going to the bathroom or focusing very intensely on our symptoms. And so it is, in a way, speaking to the part of the brain to remind it, just like you know how to breathe without thinking too much about breathing, you know how to go to the bathroom. You know how to not heavily focus, which is called visceral hypersensitivity and visceral hypervigilance to our sensations that are happening in the body.
Reel typically takes patients through 7 sessions of hypnotherapy over 4 months. Since the pandemic, the meetings are all virtual, so patients are able to be in their own home. Each one usually starts with a discussion about the patient's life in general before diving into the hypnotherapy. Reel begins this portion by guiding a patient through a passive muscle relaxation.
If people have ever done yoga, and at the end, sometimes during Shavasana, you'll get walked through a passive muscle relaxation. So really kind of starting with something pretty tangible, noticing how your body is feeling. Then we do something called deepening, where I'll start to count from 1 to 20, and I'll use that count to start to give some imagery. So I might have them envision walking down a staircase or floating on a cloud, something to kind of start to draw their attention inwards and on my voice. All of the other life distractions start to kind of fade away as I'm giving you something tangible again to envision and imagine.
Which takes about 15 minutes. Reel encourages the patients to use all of their senses. Feel the sun on their skin, see the wind move through the leaves, and hear the waves crash onto the shore.
And then we infuse some suggestions about the functioning of their digestive tract. So maybe something like, if I've described a beach scene, starting to give suggestions about, in the future, you'll pay no more attention to the sensations of discomfort in your stomach than you might pay attention to the waves crashing in the background on a beautiful day at the beach. And we discuss over and over different suggestions, different ways to address either pain sensations or motility sensations, catastrophizing about your symptoms, letting go of worry. And we infuse that in ways that make sense and kind of work together with the imagery.
Once Reel reaches the end of her suggestions, she counts the patient back into the present. The entire process takes about 30 minutes, and though the patient is in a state of extreme relaxation, they always have full control over their body. In between these one-on-one meetings, the patients will listen to audio recordings at home each day to help practice the suggestions and muscle relaxation.
It's creating some habit and ritual in terms of self-care and stress management that even after you complete treatment, and research shows that once you complete treatment, you probably don't need to continue to do gut-directed hypnosis. But I always tell my patients, let's save that time. You've carved out that time for self-care and for relaxation. Your body needs it. We all need it. And so let's continue to utilize that time for your own self-care, whether it be using another relaxation app or using your own kind of imagination to do guided imagery or relaxation.
And if you have a flare-up in the future, you already have the tools to use as a coping strategy. Currently, the bulk of the research has looked at using hypnotherapy for treating IBS, but Real says it's also being studied for upper GI conditions that are tough to treat.
So diagnoses like globus, which is the sensation of feeling like there's something stuck in your throat, but it's a benign sensation and one that can be very difficult to treat from a medical perspective. Hypnotherapy, very effective. I did a small pilot study on the use of functional heartburn, meaning that people that had heartburn symptoms, but did not have actual acid reflux, and therefore they didn't respond to something like a proton pump inhibitor. So medication wasn't effectively managing their symptoms. And we found hypnotherapy was very effective. So it proves the brain-gut axis, the esophagus just falls along that pathway. And so we could use the research from lower GI kind of benefits and applying them to upper GI benefits.
However, Real says that hypnotherapy won't fix your condition if you also have unmanaged depression, anxiety, or history of trauma. She recommends to first address those mental health issues before moving on to your gut.
We want to prioritize your mental health first before diving into something like brain-gut behavioral therapy with somebody like myself. And so that's just, I think, an important caveat to consider in terms of the efficacy of these types of interventions. And then, once you feel like your mood or trauma symptoms are a bit more stable and the GI symptoms are maybe still there, then that's when you can really dive into this type of therapy.
Real's book, Mind Your Gut, is available now. You can find more information about Dr. Megan Real and all of our guests on our website, ingoodhealthpodcast.org. For more behind the scenes, follow In Good Health Pod on Facebook, Instagram, and X. Our writer-producer is Kristen Farah. Our production manager is Jason Dickey. I'm Greg Johnson.
In Good Health returns in just a moment.
United Health Group is bringing in-home treatment directly to patients, closing care gaps, identifying risks earlier, and improving patient outcomes. In 2025, patients received over 19 million home visits. Learn more at unitedhealthgroup.com/commitment.
Life's busy. Don't let banking slow you down. Whether you're paying bills, setting savings goals, or just splitting the check, Atlantic Union Bank makes managing your money easier. With helpful people and user-friendly tools, we make sure banking with us fits you. Call, visit us online, or drop into an Atlantic Union Bank branch today. Atlantic Union Bank. Any way you bank.
The new LinkedIn Hiring Pro can't undo your last hire. The empty seat. Who was actually just that? An empty chair in your office because you couldn't find someone to fill it. So it just sat there costing you money with all its fancy ergonomic features. But LinkedIn Hiring Pro can make it easy to fill that seat with the right candidate. With nearly 60% of businesses finding someone to interview in the first week alone. Hire right the first time with LinkedIn Hiring Pro. Post a free job today at linkedin.com/Pandora.
Few things are as uplifting as the greatest moments in sports. And nothing brings us together quite like Team USA at the Olympic Winter Games. From NBC Universal's iconic storytelling to the innovative technology across Xfinity and Peacock, Comcast brings the Olympic Games home to America, sharing every moment with millions. When Team USA steps onto the world stage, we're not just watching, we're cheering together. This winter, we're all on the same team. Comcast, proud partner of Team USA.
Medical notes this week. The ongoing war on antibiotic resistance. Researchers may have found a new way to reach deep-seated infections without wrecking the rest of the body. According to a study published in Military Medicine, scientists have successfully used a needle-free device to deliver medicine directly into the infected tissue. It pushes the medication through the skin rather than into the bloodstream, which helps avoid the common dangerous side effects of antibiotics such as kidney damage. Science has rediscovered a forgotten skeletal tissue that could be the future of facial reconstruction. A study in the journal Science describes the unique properties of lipocartilage, a fat-filled tissue found in our ears and noses. Unlike typical fat cells that shrink or grow based on diet, the ones in this tissue maintain a constant size, offering a resilient material for 3D printing customized grafts. It opens a new door for regenerative medicine that could end the need for invasive rib cartilage harvesting. A common bedtime habit might be preventing your brain from performing its nightly deep clean. Poor sleep is a precursor of neurodegenerative diseases, partly because it doesn't give the brain a chance to remove waste. New research in the journal Cell reveals that sleep allows the body to wash away toxic proteins associated with Alzheimer's and dementia. However, Ambien, a popular sleep aid, suppresses this process. Scientists worry long-term use of this medication may lead to neurological disorders. And finally, building public trust in science may rely on appearances. According to a new study in Nature Human Behavior, many Americans, particularly women and people of color, report higher levels of confidence in scientific claims when they see themselves represented among the researchers. The findings suggest that demographic inclusiveness is not just symbolic, but essential for ensuring that scientific information successfully influences public policy and decision-making. And that's Medical Notes this week. I'm Mayan Vasta Betancourt.
Life's busy. Don't let banking slow you down. Whether you're paying bills, setting savings goals, or just splitting the check, Atlantic Union Bank makes managing your money easier. With helpful people and user-friendly tools, we make sure banking with us fits you. Call, visit us online, or drop into an Atlantic Union Bank branch today. Atlantic Union Bank. Any way you bank.
Thank you for joining us this week and every week as we break down the science stories you need to know. You can find all of our past segments and guests on our website at ingoodhealthpodcast.org or wherever you listen to your podcasts. Follow us on Instagram, Facebook, and X for more behind-the-scenes content. Tune in next week for another edition of In Good Health.
Bringing your business dreams to life takes heart and about 1,000 decisions a day. That's why Atlantic Union Bank's knowledgeable bankers are here for you with the right guidance and customized solutions to help you reach your business goals. So whether you're planning your next move, upgrading your space, or scaling to meet demand, we make sure your business is ready for what's ahead because we're big enough to support you, yet small enough to know you. Atlantic Union Bank. Any way you bank.
The new LinkedIn Hiring Pro can't undo your last hire. The empty seat. Who was actually just that, an empty chair in your office because you couldn't find someone to fill it. So it just sat there costing you money with all its fancy ergonomic features. But LinkedIn Hiring Pro can make it easy to fill that seat with the right candidate, with nearly 60% of businesses finding someone to interview in the first week alone. Hire right the first time with LinkedIn Hiring Pro. Post a free job today at linkedin.com/Pandora.